like you said earlier, a lot of people get interested in fasting because of the potential for weight loss. Even though there's a bunch of other awesome benefits that come, that just seems to be the first thing that people are thinking about most of the time. And as you've
It's
kind
the
of
hook,
confirmed, and
right?
it's the hook, right? But then, oh, oops, I reversed my diabetes. Oops, I don't need to take blood pressure pills anymore. Like kind of things that come along with it. But because people are so focused on weight loss, they can get really hung up on it, like day to day or whatever. Like, oh crap, I weigh half a pound more today than I did yesterday. Oh no, this is all a failure. What am I going to do? So I think that's actually really common. So what would you say about what are kind of reasonable or realistic weight loss or fat loss expectations when people are kind of going into fasting? And of course, it depends on the type of fasting and the schedule and all that. But how do you kind of think about the expectations and maybe even comparing it to men, if you have any perspective on that as well?
Well, that's a good question. That the last question there, comparing it to men and women lose weight differently. Okay. Premenopause and postmenopause. So premenopause women are cyclical, right? We have a menstrual cycle, meaning that we lose weight in a cyclical pattern. If you're actually implementing a weight loss protocol, a fasting protocol for weight loss, we lose weight cyclically. So right there, that's all women need to know, is that we actually lose just as much weight, if not more weight than men in the long term, if we're doing the right protocol. And that is what we've seen. However, we lose weight in a cyclical pattern for obvious reasons, which I explain in my webinars and in my community meeting interactions. Whereas men lose in a more linear pattern. If they're doing the right protocol, men will notice a more linear loss. But what that happens often is they lose a lot of weight initially, and then it sort of slows down. And if they're doing the right protocol, they will continue to lose weight. Women, it's the opposite. They tend to start losing very little at the beginning, but as they heal, as they become less insulin resistant, and there's that's a medical term for the condition that is behind all of the metabolic syndrome expressions that we talked about. So women tend to lose weight a little slower at the beginning, then they lose weight in a cyclical pattern, but as they heal, they lose more weight and quicker. So they start to lose more and more weight the more that they heal. So over time, they lose more and more weight. So it's a totally different pattern of weight loss than men. When it comes to your first question about what's a reasonable amount of weight loss, again, the weight loss thing, I think, has become nothing but a hook. People come in because they want to lose weight. Eventually that changes. And it changes because of our conversation, right? Our community conversation, our focus. It becomes much, much more about body composition than it is about weight. Because as you probably know as a man, you have a lot less focus on weight loss, a lot more focus on body composition. You're much more interested in how much muscle you have and how your clothes fit. And women focus a lot on that scale, but the scale means very, very little because you can weigh a lot more and look a lot thinner and have a lot more muscle. So as women become more informed, their focus eventually changes too. But please note that, again, it's not women's fault that they focus so much on the scale. It's been implemented and it's been sort of bombarded into their psyche since they were little to care so much about how much they weigh. Whereas really they should be caring about their size and how their clothes fit and central obesity and health. So I do think that change, that's part of the paradigm and mindset change that happens with information, with the right amount of information. So I'm not sure what the reasonable amount. I think over time, I've always seen people lose about 2 pounds a week. I always said was somewhat reasonable, but you could lose 10 pounds in a week, as many people have seen with fasting. But really, it's the realization that a woman's weight loss is usually cyclical. So you lose weight for about 2 weeks, and then you don't for 2, and then you lose again for 2. And that's the way it is if you're premenopausal. Postmenopausal, it can be more linear. But again, there's an amount of healing that must occur for women to start seeing significant weight loss.
Great points. I like the way you talk about it as cyclic, because that's easy to kind of draw a graph or imagine a graph where like your weight loss, velocity, your weight loss progress is kind of going up and down, but the overall direction of that line is in the right direction.
That's right.
So you can't really look at it day to day, today's weight versus yesterday's weight, or you're going to often feel like you're regressing when you're actually moving in the right direction. So you got to look at it a little bit, zoom out and look at it a little more long term.
Absolutely. And if you're using fasting as your weight loss strategy, then it would make sense that you don't become so obsessed with the scale, because your weight the day after a fast versus the day after an eating day is going to be different. It doesn't make sense that you would lose consistently, constantly. It has to be in this non-linear sort of pattern, right? Because you lose more weight when you're fasting, and there's a natural sort of regain on your eating day, and then you lose again when you're fasting and then regain. And that's the way the pattern goes.
Yeah, makes sense. I also like the focus, what you brought up about body composition. And I've talked about that before, but that's kind of a good way to put it, because obviously most of us have heard at some point that muscle weighs more than fat. And so if you gain a little bit of muscle, then you weigh a little bit more. And then I think sometimes women are kind of scared if they hear like gaining muscle, then sometimes they're kind of afraid of like, oh no, am I going to look like a bodybuilder or something? That's not what I want to look like.
That's almost impossible to happen, because it's so hard for women to put on muscle. And the women that we see that have a ton of muscle, there's so much that goes on for that to happen. So it's not because of our hormones, because they're different than men. It's so hard for women to put on muscle. It's beneficial to put on muscle, but that's definitely not what's going to happen. You're at least not going to look ripped, like this. And I mean, it would be nice if that was the case, but that's not what happens to women. We don't have those hormones most of the time.
Pretty much that's not going to happen, but just kind of understanding what you said about body composition, just understanding that you can be improving your strength, and you can be increasing your lean body mass. You can be reducing your body fat. You can be doing all those things, and you might not lose very much weight in some cases, at least for periods of time, because you're gaining a certain type of weight and losing a different type of weight. So just focusing on the body composition makes a lot more sense than looking at what you're doing on the scale each day.
And also women, as we get older, and I always look at getting older as a wonderful thing, never as a negative thing, right? We are lucky to get older, but we do lose our lean mass. We do lose bone mass. And this is something that women are very concerned about. And fasting actually has been shown to help increase our bone density. And that's a major bonus